So the final presenter probably needs no introduction. Matthew Carroll is the co-principal investigator for Gippsland, and he's going to talk about some local outcomes for the study. Over to you, Matthew.
So as Michael said, I've been given the task of giving you a quick update on the key outcomes in the last year. And we always keep in mind that the primary aim of the Hazelwood study is to address the concerns of the community. That's the only reason why the study took place, was because the community asked for it. And that remains our primary focus, which is why we do these updates, why we put all our findings on the website and our newsletters, and we go out to the local media, etc. And we always try and get to the community before we get anywhere else, because the community is our primary target for the study. And as you remember from the time of the mine fire, there was a lot being said about there's no evidence of the health impacts of an extended smoke event, or particularly a coal mine fire. And that was true. At that time, there was no evidence, but there is now. And we've done a lot of work looking at the short and long-term impacts, and we're releasing findings on both short and long-term as we roll. So as we've seen today, we found a short-term increase in ambulance and hospital services for mental health-related concerns during the mine fire. We found long-term impacts, including the event-related distress that Tim talked about, particularly in younger people, which was 6 years after the mine fire event. The increased respiratory-related hospital admissions for women in the 5 years after the event, and the delays in NAPLAN performance in school-aged children in Morwell up to 4 years after the event. So we're still reporting on both those short and long-term outcomes. But we're also finding information that's of general relevance to the local community and to the wider regional and rural Australia. So as we saw today, we found interesting findings about e-cigarette use, including increased asthma symptoms and abnormal lung mechanics in users, but also about the factors that may predispose people to taking up e-cigarettes, such as younger age and mental health conditions. And that's really important information that can be used in public health messaging locally and elsewhere about the take-up of e-cigarettes and the possible consequences. So that's really important findings. We've also mentioned that there was some evidence of increased cancer incidence in the Latrobe Valley, and that warrants further investigation, obviously much more investigation about what any Hazelwood link might be in the future years. So there's work to do there. And as we mentioned last time, some of the data that came out of the cardiovascular stream on local food preference informed the development of the local healthy eating initiative, My Food Swap. That's now been put up as a grant proposal, which has been taken up by the Latrobe Health Assembly. And there's considerable work taking now over the next couple of years to actually try and improve the food preferences for locals. So that's a really important public health message. And it's a really good example of how we're looking to work more closely with the Assembly and the Advocate and with the local health services and everybody else to try and ensure that the findings from the study are taken up locally and more globally for the benefit of all of us.